So guys, thank you for being here. I want to have Matt introduce himself really quickly. And before he does, guys, you click on his name a couple times. You're going to be able to follow him. Okay. And if you guys have questions in the chat, please put them in. Explain who you are, Matt. Go ahead.
So I am a licensed physician assistant. I've been a PA for about 17 years. And I practice medical weight loss. And the reason I practice medical weight loss is because I struggled with obesity for a long time and I yo-yo dieted for 20 years. Now it was 90 pounds over the course of 20 years ultimately, but it was a very long time of making a lot of mistakes. So now in this field, I'm a big believer in utilizing GLP-1s to help people with obesity. However, I've never taken one myself, but the evidence is pretty clear to me. They are very effective medications.
I love it. So let's just start on the questions, and feel free, guys, to ask your questions here. We'll get to all of them. So what is a good body fat percentage goal for women?
Ooh, maybe somewhere around 25 to 35% seems to be like as far as the number of possible comorbid health conditions that may result. It doesn't mean that if you're higher than that, you are unhealthy. But it doesn't mean if you're lower than that, you're unhealthy. But most people in the bell curve women fall into kind of that range, I believe.
I love it. Someone is asking, if someone weighs 400 and eats the same amount of protein as a 200-pound person, was that something that can be done? Is that normal? What do you think?
I don't think it's a good idea to eat that much protein, like double the amount of someone of 200 pounds, because you're not utilizing other macronutrients the way you could, especially utilizing carbohydrates to help with exercise. And I'm assuming that if you're getting 400 grams of protein a day, there's some fat that's making its way in. Most people are not fat deficient as far as nutritionally. But yeah, I just feel like you could use those calories in a much better way.
So tell us about your your principles, the things that you like to talk most about when it comes to your practice.
So I look at losing adiposity or losing body fat. That three different things have to be in place for you to have maximal benefit. And that is, you got to have a calorie deficit. I realize some people don't like to track. You don't have to track, but you do need the energy deficit. You need protein, and that amount varies on person to person. And you need some way to stimulate muscle, preferably with some form of increased tension. That's what we call resistance training. Could be weightlifting, could be Pilates, could be bands, could be body weight exercises, but something to stimulate muscle. So those are the three.
I love it. Now we have a question. This is a big one. Diet soda. Oh my goodness, is that going to derail me or what?
No, if diet soda was going to make you gain weight, I should be a lot larger than I am now. I drink a lot.
Yeah, but Matt, what about the insulin spikes even with diet soda? Come on, doesn't that a thing?
To my knowledge, there is no obvious or objective evidence of diet sodas causing insulin spiking or blood sugar spiking.
Love it. So someone says, listen, if I can go off TERS, can I go off TERS after getting to my weight? What's your thought on that?
So one, I want to make sure that people know you don't have to go off medication if you don't want to. You could be on it lifelong if you want to. We have no reason to believe that people need to come off the medication. But I also have a lot of patients who they want to come off medication. So to me, then there's a few ways to kind of handle that. But I really, really want patients to be able to, they have good handle on no diet and they're active in some way and they're able to sustain that and they can be flexible with it. So if they go on vacation and they gain a couple of pounds, it's not the end of the world and they can readjust and they're back to where they were. Yeah. But if you do, so there's ways of doing alternate weeks, doing lower dosing. But yeah, that to me is what I look for people who are more likely to be able to come off the med.
Yeah, I agree. I think it's interesting in my, example of my life. It's like, I have done so many things that I know I need this treatment for life. And maybe someone hasn't done that, right? They don't know, they're not thinking that way. And so maybe they'll have to get back on, maybe they won't. But for me, like, I know for myself, like, my goodness, I need this treatment for life. So it's different for everyone.
Mm-hmm. Agreed.
So is there a thing about too much protein intake, right? Is there a harm if you go overboard?
We actually don't know. That's the weird thing. We don't know. We don't know what the upper limit of protein really is. But at some point, if you increase your energy intake, you are going to store more body fat. Like there's some number up there, right? Now, maybe if you focus more on protein, that number is a bit higher, but still ultimately there is a point where it's too much. But as far as like issues with kidneys or issues with other organs, unless you have underlying kidney disease already, then no, it's unlikely that it's going to be harmful in an excess amount.
Yeah. So Lindy has a great question. What's the difference in sugar and sugar alcohols and like the labels?
So there's aspartame, there's sucralose, there's stevia, there's monk fruit, and then there's the sugar alcohols. The first previous ones, so like aspartame, sucralose, stevia, don't really seem to cause a lot of GI distress, although anyone could have any reaction to anything. But the sugar alcohols in a certain amount, it seems to be a dose dependent thing where if you use a lot of them, you may have some GI upset, but the degree of upset just may vary from person to person. But as far as calorie intake, the sugar alcohols may have some metabolizable energy, but for the most part, it's negligible, especially in the grand scheme of overall diet.
Yeah. So Jen has a knee replacement surgery coming in January, and she asked, will they have me stop TERS temporarily until complete? And so explain why that would happen.
Only for the week prior to surgery, because anesthesia wants to be able to make sure that the GLP medication is not interfering with your GI movement. Because when you go under with anesthesia, everything's paralyzed, and your gut sometimes takes a while to wake up. And so if there's GLP-1 medication on board, that can take longer, cause issues with constipation and other issues as well.
Yeah. Don't worry. Just do what you need to do and get back on treatment.
Yeah.
Drew was saying maybe kidney issues with high protein doses he worries about.
Yeah, it just depends on like how like advanced someone's kidney disease is. That seems to be like the marker. Like remember like stage 3. And there's multiple stages of chronic kidney disease, but it's around stage 3 where you start to really have an issue. But there's still a lot of debate up in the air as to whether there is or is not a safe amount of kidney disease.
Yeah. So Emma talks about menopause. A lot of people come in here and say, "Oh, I wasn't able to lose because I'm in menopause," or it just kind of. What are your thoughts on that? Like, can people kind of overcome that, or I don't know. What are your thoughts on like hormones like that when they're, you know, that's
With menopause?
Mm-hmm.
So menopause, I obviously have never experienced it myself.
What?
Funny. But from talking, most of my patients are postmenopausal. And the principal thing that I hear is my energy just goes down. I just feel different, and that's real, right? That happens. So that alone might affect like how eating and movement will work too, because if you're not feeling yourself, you're maybe not feeling up for wanting to be more active, which is very understandable. And then that in turn can drive more eating because your natural response when you're tired is to eat more food. But it doesn't mean that the process wouldn't work. But I have obviously a lot of different postmenopausal women who are very successful with using the medication to help with weight loss. And they find they just have this, it's like I've tried everything and this was the only thing that worked. It's a very common story.
I would say, Emma, have a conversation with your doctor, right? He's going to help you understand when you can get back on the medication.
Mm-hmm. Yeah.
Yeah.
Yeah. I've had patients where they've told me that they've been told that they could go back on like as soon as they want, but some people may like, hey, let's wait to see the bowel movement first. It's just very dependent on the surgeon.
Yeah. So hair loss. So talk about that. Dose of G's, curious about the hair loss and prevention on TERS and how that all works.
So hair loss seems to be more of a matter of just the rapid weight loss that can occur if, like, let's say the dose is too high, so you're not eating anything or much of anything. So your calorie deficit is like super, your calories are way down. So it doesn't allow you to get in enough protein, enough vitamins and micronutrients in order to actually help with hair, preventing from falling out. But you could also do everything right, and sometimes hair loss can happen. But it's usually sometimes we'll stop when the weight loss stops or nutrition increases or both. But for some people, it does just happen.
Yeah, it happens for me all everything.
Telogen effluvium. That's right, Emery.
That I didn't have. All right, I will introduce myself again, guys. My name is AJ. I go live Monday through Friday in the morning to have support here, a place where we come together and hang out and just encourage each other about wellness and mindset, and of course GLP-1 medication. So make sure you follow me if you haven't. Click the follow button. I have Matt Boutte up right now, who's a physician's assistant. He does go live too, as well, 6 p.m. Monday through Friday, sometimes on the weekends as well. So click his name a couple times to follow him. Right now, we're asking him questions. Any question is welcome, guys. So take this opportunity to ask anything you want. There's no silly questions, guys. So keep asking everything that you want or have questions about. Prenatal vitamins that helped with weight loss, or I'm sorry, hair loss, MSS.
Cool. Nice.
Yeah, good morning, guys. Thank you for being here. So ask your questions. Let us know what's going on. Talk about your CPR. CPR. What's CPR mean to you?
So I used to do emergency medicine as a PA, so I tend to think in terms like, emergency stuff like CPR, right? But that's now translated to my 3 principles of fat loss and body recomposition with my patients. So calories, protein, resistance training, CPR. And, I look at that as a guideline for you choose the method of how you execute that. And just make it easy. Just make it easy. Easiest way to get in a calorie deficit, easiest way to get in protein, easiest way to be more active consistently. Because even though I have a gym routine and an exercise routine that I really like, I don't want you to do exactly what I do because it may not work for you.
Absolutely. Right. We want to have this be enjoyable. We want to have joy in our life. We want to be consistent, right?
Yeah.
So,
hell yeah.
Yeah. So M asks, what is one thing you wish patients knew starting these medications? When you look back and you have conversations, what's one thing you wish?
That they knew how important it was to still focus on your nutrition. Like really. There are still enough people who take them and don't really focus on their eating. I look at with the medications like it's your chance to be able to have the food noise quieted down for a bit so that you can actually find nutritious food that you actually enjoy. Some lean proteins you really like, some fiber sources you really like. This is the time to start enjoying fruits, to start enjoying vegetables, and find different ways to prepare them and combine them to make really tasty meals. And between, TikTok and a lot of different recipe channels and AI, like there's so many ways to combine all this stuff just to make it tasty, but still check the boxes of what you need, which is really important on when you're taking a GLP-1 to lose weight.
It's so crucial. I think, so much of this stems from the struggles that we've had, not understanding this as a disease and having things be told that we can't have, carbohydrates and then all this stuff. And so we have to kind of work through this. It's a mental thing that we have to work through, and that we should enjoy food. Food is meant to be enjoyed, guys, right?
Yeah.
I mean, come on.
Yeah.
So it's a lot of work that we have to kind of work through.
Yeah. There's been so many times in the past where when I was trying to lose weight and like, I just want Friday night off. I just want Saturday off. I just want to like eat pizza and drink beer and just not worry about things and not realizing that because I was so restricted for the majority of the week, I was missing a lot of the stuff that I used to like and didn't understand how to incorporate that into an overall game plan that worked for me.
Yeah. Yeah. So Jen, it's hard sometimes to talk about food on here, but we can try it. What our typical meals are. I mean, that's kind of hard for me to say. I'm very varied on things. I eat everything in moderation. But I would say my go-to things as far as something that is, I don't know about you, Matt, but like for me, I love a lot of, I make my protein on the weekends and have that ready so I can always have protein ready. But I do a lot of like burritos and quesadillas and tacos, flour tortillas, corn tortillas, whatever the meat is, and just make it really yummy with veggies and salsa and hot sauce and just something, I don't know. That's kind of my go-to.
Yeah, just keep it easy, keep it simple, keep it to things that you like, right? If you like quesadillas, then get good at making like high protein, high fiber quesadillas because they exist and they can really be really tasty.
Yeah. Awesome recipes on IG that help. Yeah, there's so much information out there, guys. So much information. Anybody have any thoughts or questions for Matt Boutte? We've got him on today. He's a physician's assistant. Do you want to talk about your practice or like what you do down there to help people in Texas?
Sure. Well, right now I work for another practice, and don't like the way that the practice is run necessarily. So I'm looking at forming my own, and that's in the works. I'm hoping by the end of this year to have it up and running, only in Texas. But I basically want to construct it as I'm your coach, but I'm also your medical provider when it comes to weight loss. So we manage medication, we manage, what you eat, and then help you figure out the best way to stay active and just monitor and be consistent with that during your time with me.
Yeah, absolutely. Doing so much better on one, even though I did go up in weight some. Yeah, it's interesting with the GLP-1s. I don't know if you've experienced this where you've kind of maybe shifted the dose down a little bit and see how people do. It's a real thing. And I think a lot of people don't, they feel like I can't go down. I can't go down because in their mind, they think they have to go up to the highest or whatever. And it's a lot of education that needs to be had by these GLP-1 medications for sure.
Yeah. Oh, Paul, Dr. Paul. I met Dr. Paul yesterday.
Yeah.
Do you plan to take insurance? I do not, Dr. Paul. Move to
Yeah.
NJ so I can come see you. Christine, go across the river to Pennsylvania and you can work with Dr. Paul Bowman here in the chat. He's got his own medical practice, does obesity medicine.
Yeah. So Ron is asking, how do you get over fatigue, right? And that's kind of a broad statement there. There are many things that could be happening, but if someone were to ask you that, like Rhonda says, what were your thoughts be?
Can you repeat it? I'm sorry.
Yeah, she's asking about fatigue. How do you get over the fatigue?
Oh, fatigue. Yeah. I think that there's one big way is you can adjust your meals to around where you're feeling the most tired. And let's say you need to get in fiber anyway when you're on a GLP-1. So maybe you put your carbohydrates that are fiber forward around that time period so that they can be digested. You get that nice steady state of energy that you get from the complex carbohydrates. You're getting in the fiber already, and that might help your energy boost at that time. But I also don't mind a lot of caffeine too. But some people's caffeine tolerance can be really variable. But the fatigue a lot of times is from under eating, and you're going to have fatigue when you diet anyway. The hunger you're not going to experience as much because you're on the GLP-1, so it's helping that aspect of it. But hunger and fatigue are like the two principal things you got to manage on any diet.
Yeah, absolutely. So let's talk about vision loss really quickly. I don't know user 4 or 5's experience. Maybe that person can expand a little bit. But overall, when someone comes in and goes, "Oh my goodness, does these cause vision loss?" Tell us what you know about it. Go from there.
So the thing that people are worried about with vision loss is this disease called non-arteritic ischemic optic neuritis, or NAION. Basically what it means is that the optic nerve that allows you to have vision, so it actually sees the pictures and translates back to your brain, gets choked off because it gets swollen and where it enters into the eyeball. And so it needs blood flow, and it doesn't get blood flow, so it starts to choke off and it starts to get injured and you have this vision issue. That's a very rare thing that happens already. And it's also very rare to happen when people take GLP-1s. They've started looking at this with studies in the last couple of years, and the cumulative risk seems to be less than 1%. And that's from looking at like thousands and thousands of patient databases. The other aspect of it, though, is that most of those people who are at risk have diabetes or insulin resistance. And yet the single biggest cause of blindness in patients with diabetes is diabetic retinopathy. So if you have untreated diabetes for a long period of time, that alone is going to cause significant vision issues. So the benefit of treating your hyperglycemia and insulin resistance with the GLP-1 is going to help reduce your incidence of diabetic retinopathy. And compared to the risk of the NAION, to me, it's a no-brainer. There's more risk with the diabetic issue.
Absolutely. Yes. Thank you guys for the questions. Keep them coming if you have them. No silly question, right? This is the opportunity for you to ask anything you want free of charge, people. So my name is AJ. I go live Monday through Friday in the morning to be a supporter, like a cheerleader for people on this medication. on your wellness health journey. I have been living with the disease of obesity since around 8 years old. I've done everything in the books, fen-phen, HCG, lap band, gastric sleeve. I'm on a GLP-1, been taking it for 2 years, lost around 86 pounds, my highest of 344. I go live, so make sure you follow here. Right now, I've got Matt Boutte on, who's a physician's assistant out of Texas. He goes live Monday through Friday, 6 p.m. Central Standard Time. Click his name a couple times to follow. Ask any questions you want, guys. This is a great opportunity. We have 143 people in here. Please take this time to listen and ask questions. We're here for you. So shot does or doesn't affect vision, Sweet Marie says.
I say no. The causation has not been proven.
Yeah. Does estrogen patch interfere with ZEP at all?
I don't think it will. I can't think of a reason why it would, but I don't. So. Yeah, I off the top of my head, I can't think of a reason why it would.
Yeah, I mean, thank goodness you're on something. I need to get back on BHRT. Bad stat. Excited to do it.
Sweet Marie, I am not a physician. I'm a PA. I want to
explain what a PA is, if you don't mind, really quickly, for those that wonder.
So a PA the title is physician assistant. It's now been changed to like physician associate, but we as a profession have been around for almost 60 years. And basically a physician who trained doctors during World War II took that model and trained people who were ex-military and trained them up to become medical providers. And the profession kind of grew from there. So we're licensed in all 50 states and other countries as well. We can do everything, can prescribe, can diagnose, treat, assistant surgery as well. But all PAs have a supervising or collaborating physician that they work with. So like I do when I practice.
Love it. So what do you say to patients who are afraid of carbs? Ooh, we love this topic, Matt. And here, guys, remember, we're going to get to all your questions. So keep asking them. We will get to them. Diet culture can be hard to overcome. So when it comes to carbohydrates, what do you say?
So I think the messaging that carbs are bad is just very, very harmful because, it just creates this like weird restriction that there's a good and a bad when it comes to food. And like you had mentioned earlier, like I don't see morality when it comes to food. It's just food, right? It's like it either has proteins, fats, carbohydrates, vitamins, micronutrients, and all that stuff. It's a substance, that we can use. And if you are active, it is the quickest and best form of energy that there is. The nice thing that when you are active is that the carbohydrates can be utilized not only for activity then, but also you can store them in liver and also in muscle. When you start to build up muscle because you're more active, then you can offset that issue of having high blood sugars better and making yourself more insulin sensitive. But as far as like carbs have to be cut in order to lose fat, I mean, it doesn't, because the energy is still comes from somewhere. Like energy balance still dictates whether someone loses fat or gains fat, regardless ultimately of the macronutrient breakdown. Now it makes it, obviously those macros matter, but the energy balance is ultimately what's going to drive that. Yeah. And some people can follow a high carb diet and lose fat, and some people can follow a high fat diet and lose fat, because in my opinion, it always comes down to patient preference.
Absolutely. So injection site rashes or itchiness. I always say Benadryl cream or spray. Any insights to that? If someone has that in your practice?
Basically that, maybe topical steroids. But yeah, otherwise, no, pretty much the same.
So MSCGM spikes with carbs, like fruit included. So she has troubles with carbs. Any insight to that?
I mean, so carb spiking as an isolated number, to me, I don't worry as much about, unless you are really prone to like rare diseases like diabetic ketoacidosis and you get like really sick really fast with high blood sugar, because we're talking about just controlling the blood sugars over time. So it's just an over time thing, because the cumulative damage that occurs from high blood sugars is an over time aspect. So damage to kidneys, damage to blood vessels, damage to eyes, damage to other areas. I like it very similar to, if you're familiar with LDLs and how they correlate with coronary artery disease. The higher the exposure to high LDL, the higher the risk is of developing plaques. Now, but that doesn't mean that you should never focus on blood sugar. But it's important to at least understand like the context of why having lower blood sugars can be helpful in the long term. But if you're eating fruit and it spikes your blood sugar, that's not a bad thing necessarily, right? especially if you're eating fiber forward carbohydrates, because it's going to limit that spike if you're really worried about that, but still give you that nice prolonged energy. And a lot of fruit has a lot of good vitamins and micronutrients in it too.
I love it. User 4 is appreciating this conversation, which I love. Thank you for being here. So it's talking about he or she's asking about memory loss. I'm not exactly sure in what context, but
Mm,
maybe this person thinks that there's memory loss associated with something like this. I don't know. Any thoughts on that?
yeah.
Thought more question, more detailed
Don't
thought?
have I don't have any, except
No.
that I think that there was, and Dr. Paul can correct me if I'm wrong about this, but that there was they looked at GLP-1s affecting the rate of Alzheimer's, and it didn't seem to have a beneficial effect. But from that aspect, I guess that's the only thing I could think of. But when you reduce, when you make yourself metabolically healthier and you're more active, that alone is going to reduce your risk of Alzheimer's by itself. So
Mhm.
to me, it still would be a net benefit.
Yeah, Dr. Paul is asking the upper limit on protein recommendations in grams.
On a bolus of protein. So
Yeah.
interesting, Dr. Paul, there was a study that came out a few years ago that, now this was in resistance trained men, and they looked at like whey protein intake, and it was 25 grams versus 100 grams post workout. And they found that the 100 grams, they still had protein synthesis, not just muscle protein synthesis, but also other tissue protein synthesis that extended like way beyond. So all the protein got absorbed and utilized. So we actually don't know what the upper limit is of like bolus of protein that gets utilized. And certainly from a day-to-day aspect, I think you're really good about recommending certain protein amounts during the day. But as far as bolus, I'm not aware of any upper limits.
Clara is talking about allodynia. She gets these random, itchy areas on her body. Any experience with that with your patients and what you would say or do when someone has that allodynia?
Other than maybe skipping a dose and seeing if that has some effect, or reducing the dose, maybe switching to the other medication. If we're on one, maybe switch to the other. Um, I don't really have many people who have that effect actually in my practice,
Mm-hmm.
fortunately.
Yeah, I know it can happen, man. I haven't
Hmm.
had that happen either. Crazy. Guys, listen, thank you for being here. My name's AJ. I go live in the mornings, Monday through Friday, to kind of have a lived experience, helpful tips and advice live. So make sure you follow here. I've done bariatric surgery. I've had the disease of obesity for decades, and I'm on a GLP-1 medication to treat the underlying condition here. So follow me here. Right now, I've got on Matt Boutte, who's a physician's assistant out of Texas. He is talking to you guys about anything. So ask your questions, anything that you have that you're thinking. Just put it in the chat. You can ask me anything as well. I'm an open book with my journey as well. So click his name a couple times. Make sure you follow. He goes live Monday through Friday, 6 p.m. Central Standard Time. Why are you not picking my questions, please? So here's the thing, Royal. A lot of times, unfortunately, TikTok can filter things, right? So what I suggest for you to do is add emojis, misspell something, put periods in between your words. I know it's a pain in the butt, but maybe your question will come through. I do read all the questions, so keep trying. You can also DM me if you have any questions. Dr. Paul says he loves your format. You guys really were. Us together? Well, thank you. Appreciate that, Dr. Paul. So what type of expert could I see about lipedema? Can you talk more about that? Lipedema, yes, absolutely.
Ooh, probably the biggest person that I trust when it comes to that stuff is Spencer Nadolsky.
Mm-hmm.
He's a lipidologist, and I'm sure that some of y'all are familiar with his name.
Mm-hmm.
His practice, Vineyard, I'm sure he addresses that. Lipedema is really hard to tackle. I don't have any patients myself who say they are having that issue and how to deal with it.
I
But
mean,
like fat that's just stuck in certain
what
areas,
can
like
you
in
be
the
done? You've got to
thighs.
get it suctioned out. I mean,
Yeah, there's that. I don't know if cryo would be beneficial at all. But it's, yeah, I keep, every time it comes up, I try to look up and see like, where's the evidence at? Where's the evidence at as far as like what to do with it? And yeah, it's not an easy solution for sure. And I will never claim to have an understanding of how to treat it.
yeah. So Christine is asking about protein. We hear this all the time. How much protein people should get? Is it true that it should be your desired weight? We hear that a lot. It's hard because you could be wanting to be a certain weight, right? Which is not what you need to get as far as protein. And so
Yeah.
what is the actual, how does this work? What do you think?
So there was a meta-analysis, so like a big group of studies that were released a few months ago, and it seemed to be the sweet spot for protein intake was zero point 0.7 grams per pound of your goal or ideal body weight. So not your current, not what you're, maybe you lose a little bit, but zero point 0.7. But I like to give a range for patients of zero point 0.7 to 1 gram per pound. My
Mhm.
rule of thumb is that the more body fat you have to lose, the lower amount of protein that you need. When you get down really, really lean, then the protein need needs to go up if you're
And why
trying to
is
shed
that?
excess body fat.
Explain
Uh,
that.
because because you're more likely to lose lean tissue and muscle the leaner that you get when you're in a calorie deficit. It's just your body's going to start pulling from other sources other than fat. When you have a lot of excess adiposity, there's plenty of available stored energy to use. But when you get down leaner, not as much.
Yeah. So Lindy asked a great question about constipation. Is magnesium good for that and sleep?
I believe so. So mag citrate, yes. I think I'm not familiar with magnesium as far as sleep. I think magnesium
Like
glycinate
if,
is what
yeah,
people generally
glycinate
like to glycinate.
or
People like to
whatever,
use.
glycinate, glycinate, glycanate. I
Yeah,
don't know.
yeah. I don't know either.
Yeah.
I should pronounce this stuff better.
This is
I
an
personally
interesting,
like melatonin to sleep.
yeah. This is an interesting question. There are people that I know that have their nose run on these medications. So Candace is saying, listen, I once I'm full, I've got my nose running. It's an interesting way of, and there's science to that. What do you see, Matt? Do you see that?
Nose running,
Yeah, like
some
just runny nose, because
rhinorrhea.
I've seen that. I've seen that a lot.
I have not. No, not. This is the first I've ever heard that.
Yeah. So Candace, don't worry. You're not alone.
Okay,
That happens.
interesting.
So here's an
Vasomotor
interesting,
rhinitis. Huh?
yeah.
Yeah.
So Priestley Royal says, I only lost 6 on turns for 4 months. Why is my loss so slow? Any thoughts?
Let's see. Oh, sorry. Repeat that again. I'm sorry.
So this person is saying, I've only lost 6 pounds in 4 months. Why is this so slow?
Oh, um, so I mean, the fundamental answer is that you're not in an energy deficit, but if the other things to look to see if things are working is if clothes are fitting better,
Hmm.
if you are more mobile, if you see visual changes even when the scale is not moving, then something is working, right?
Yeah.
So we are losing fat, we are gaining muscle. Because if you are working out, you are, eating around where your calorie deficit should be. But if the scale's not moving, then the deficit's just not large enough. But that's okay because if we are seeing changes, changes are good, and it's more likely to be reinforced as habit so that you continue with it. And then eventually the weight does start to actually come off.
Yeah. And well, we have a disease, right? So for myself, I didn't lose anything for almost 3 months. And I like to tell people that because sometimes it takes a little bit time and treatment, right? Especially if you're insulin resistant, like really, really bad, like I was, right? So it takes some time. So don't freak out, right? Losing 4 is awesome. Nina is starting Monjaro today. That's exciting. How much protein do you need at 400 pounds? Robin is asking. How do you know when you titrate down the amount of protein?
Uh, Ideally, you do it like if you're doing body composition testing to see like where, like how much lean tissue that you have. You could do it that way, but that's also can be really annoying. Um,
Yeah.
so I, I would just, set it at somewhere, based on what you're like looking at like online to see what your ideal body weight might be just based on height and age. And then seeing like there's going to be a range of weight that it gives you. And just somewhere around there is fine.
Hmm.
And I wouldn't really think too much of it until you get down to like we're losing like get down 300 or 200, lbs.
Right. Sweet Marie has a great question. People want to build muscle while on MJ, meaning with a calorie deficit. So how does that work? Can you do that? Explain what your thoughts are.
Technically, you can, but the work is done in the training itself. Like the intensity of training matters when it comes to building muscle. And two times you're going to see like actual like muscle growth in a short period of time is when you're brand new to the gym and you're doing a consistent weight training routine, or if you trained before and you took some time off and so muscle decreased, you sprinkle on some resistance training and sprinkle on some protein and the muscle grows right back like a bunch of weeds, but good weeds.
Hmm. I love that.
So it's possible. It's just, It can be, but if you're not in one of those stages, it's really tough to put on like muscle consistently when you're in a deficit.
Mhm. Yeah, a lot of comments about the nose running.
Interesting. Yeah. Okay. I am now aware. I need to look into it.
Dr. M says possibly GERD. I mean, all of that can be related. Yeah, I think there's a correlation to all of that for sure. Blood type. Does blood type have anything to do with fast responders versus slow responders? Any thoughts on that?
Never heard of that.
Yeah, I don't know.
Never would worry about it.
Yeah,
Speaking of that, like the blood type diet, I also is not a thing either.
I know. It sounds fun.
Mm,
Sounds sciencey and like it,
it
but
does. Yeah. But it's probably gonna be some version of like, hey, eat some protein and eat some fiber. Like, thanks. I paid $100 for this blood test to tell me that. Yeah.
right,
Just
right.
like every other like bad diet advice. Like, yeah, no shit. Sorry.
Right. Storky says, I lost 25 in 2 months. That's quite a huge chunk, Storky. I mean, there's a lot of factors that you could be, morbidly obese, and sometimes you lose a little bit faster that way, or a lot of inflammation. Just be careful. We don't want to lose too fast, right? We lose muscle that way, but I'm sure you're doing fine, Storky, if you want to elaborate a little bit more on that so we know your specific situation. Jeff, thank you for the gifts, guys. If you haven't followed both of us, please do. You can follow here by obviously following here. The follow button. With Matt, you got to click on his name a couple times to follow him. He's a physician's assistant that I have on right now from Texas. He's amazing. He goes live 6 p.m. Central Standard Time. He's awesome. Guys, ask your questions today. If you haven't asked, please do. No silly question at all. I go live Monday through Friday to be a support for you guys here on your health journey, just trying to help you guys just to be happy and healthy and to know what to do for long-term success through my lived experience. And then Matt here, he's got the credentials. He can tell you all sorts of things I can't. Thank you, Storky.
Except what it feels like to be on the medication, because I've never taken it myself.
There you go. So he likes to listen to us to see how we talk, right? So
very much so.
Perspective on people who are have this disease and being treated. 6 months on MJ, did not lose anything on 5. That can be normal. User 7, I don't know if you have a question. How much is the normal to lose weekly? It varies. Edith, Matt, you want to share your knowledge on that?
I think 1 to 2 lbs on average is a good rule of thumb, but some people, if they have a larger amount, they're going to lose more initially. But 1 to 2 lbs is still loss, and that's still significant.
Yeah. Even a half a pound in my general, like, I mean, and the thing is, I don't lose all the time. So people get really frustrated when they don't see a loss every week, and it isn't like that.
Yeah, I feel like, and that happened to me a lot when I would, in the very beginning when I would lose weight, that I didn't see the visual changes, and it was really discouraging. I didn't understand why. And you realize, like, well, one, you're going to lose a lot more visceral fat first, and so waistline may shrink, but visually you just don't look that different, and that can frustrate a lot of people, I think, when they're starting out.
If anybody doesn't know what visceral fat is, put a 1 in the chat and we'll get to that. So any recommendations on to prevent loose skin?
I think that's really tough. It's at some point, if you have a larger body, you are going to have some excess skin when you reduce the fat. Best thing you can do is be active, lift weights, get in protein, stay hydrated.
Yeah. And don't let the fear of loose skin hinder you from getting healthy, Arthur. I say this all the time. I've got lots of loose skin. I've had surgeries done. I still have a lot of loose skin. I would rather be here with loose skin than be here any day. Okay. We've got another question. Is it normal to be a super responder for a while and then close to goal be slower?
I've had a few patients like that. And I think that the studies kind of show that too, where the majority of people, if they respond well, they lose the majority of their weight, like kind of up front, and then it becomes kind of a slower grind. But that's kind of the way it works when you don't use medication too. It's the same principle.
Slows down.
Yeah.
So someone is asking about a good protein and collagen shake.
I don't have a preference. I do. I was thinking about that as someone asked it. So, like, these are some really cheap things that I bought on Amazon. They're clear whey. They come in all different sort of fruity flavors. They are a mix of whey protein and collagen. They're 80 calories a pack for 15 grams of protein. So between the two, I mean, you are getting a good amount of like complete protein with the whey and then the collagen. I promise I don't sell them because they're like cheap on Amazon, but
Yeah.
they taste really good and they dissolve in water really well. But obviously, you could do any number of different protein shakes.
Yeah. Guys, if you have any questions about GLP-1 medications, what they do, how they work, where to find treatment, let us know in the chat. If you have any questions on anything when it comes to bariatric surgery, I've done it as well, nutrition, mindset, resistance training, whatever it is, carbs, let us know in the chat if you have any thoughts. I've got Matt Boutte on here right now, who's a physician's assistant. Click his name a couple times to follow. Ask your questions, no silly question. Does food eaten affect your nausea? Does food eaten, Tanya says. I don't know exactly what that means, but
The avocado, yeah.
if you are feeling nausea, a lot of times it's maybe because you're not eating enough food, but maybe clarify your question and we can answer it.
Hmm.
Yeah.
Mm.
So what's your day
Yeah,
like today? Oh, go ahead.
no, I was I got some extra work to do here soon.
Okay.
And I have let's see, got to fit in a workout at some point today. And
Mm-hmm.
then cook dinner for the wife tonight.
What you cooking?
I think she said chicken, so we're gonna do grilled chicken paired with something. Maybe some squash, chop up some squash, roast it. She'll do this thing where she'll cover it in just a shit ton of pepper and salt, and it's just
So good, right?
so good. Yeah.
So M has a question. If you're on a GLP-1, how much should we be working out each day?
That's not a that answer is going to be different for everybody. I mean, I look
Mhm.
at it more as activity during the week. The guidelines say you need 150 minutes of aerobic activity 5 days a week or during the week, right? So you split that up as like 5 30-minute sessions. But some people can't do that. And some people can do that and they can do more. So it's really what you can do consistently on a week to week basis. And if it's just increasing steps and that's what you do every day, then that's what you do every day to get started. But it's whatever is going to be easiest to just get your foot in the door with more activity.
Right. My squeaky life, congratulations on losing 55 pounds in a year. That is not slow. Okay. Maybe you're comparing
Hmm.
yourself with other people. Maybe you have high expectations, but that is perfection. And congratulations on being a survivor of the breast cancer stage 3. So any tips? I think her advice is, or her question is, any tips to lose quicker? And really that's kind of a not something we want to really think about. So tell us your thoughts on that.
Um, yeah, I mean, 12 months and losing 55 lbs, it means you've lost 1 pound per week. That's not, I wouldn't say that that's slow.
Mm-mm.
I would say that that's ideal.
Mm-hmm.
It may not be fast enough for you, and that's understandable, but that means you're still losing. And if you're still losing, you will eventually get to your goal, and it may be more sustainable because it took you a bit longer to get there. But again, I feel the frustration of like, it's
Mm-hmm.
not moving fast enough. Um, you can always adjust calorie intake to do that, but then you're kind of like messing with something that's working, and then we might tip over into like I'm losing too much, and then I plateau and I stall, and so there's a lot of nuance to it.
Yeah, I've never lost on an average 1 pound a week. So you're doing more than I am. So Christine
Hmm.
has a great question here. If I don't eat enough, why does it cause me to stall? I don't get it.
Yeah. So when you're on a GLP-1, right, you're not really driven to eat as much. And when you're not really driven to eat as much, you can run the risk of being really under as far as what your body needs on a day-to-day basis. You already need to be in a deficit in some way, but now you're in a deeper deficit. And so your body really fights back with a lot of fatigue, right? Not necessarily hunger because the medication's controlling that part, but the fatigue, it doesn't. So you're naturally driven to want to eat more so that you get more energy because that's your body's response to when you're feeling really, really tired is to rest and to eat.
Yeah.
And so having a really low intake can stall you because then you eventually want to eat back those calories. So you're really good in the first part of the week. The second part of the week, you're not. And then it all evens out so that you're just the same weight week after week.
Yeah. An awesome job, Lori. Congratulations. So Sophie has a question. What is the required hydration needed per day when on the medication? Some say 2 liters, some say 4 liters.
Somewhere around there is fine. I'd say probably, yeah, between 2 and 3 is pretty good. We know that like good urine output is about 2 to 3 liters per day. So, if you're intaking that much fluid, you should be fine.
Mm-hmm.
Clear,
Tammy's.
yeah, clear urine is always a good indicator.
Mm-hmm. So we have someone in a walking boot, so not a lot of exercise for them, which is
Hmm.
not, that's fine. You got to heal.
Yeah. Diet is where you're going to make the most progress then until you can actually get back and walking.
Yeah. When Marie says, "Man, I've been on this for 1.5 years and I'm craving more," what are you going to tell someone when they say something like that?
Mm. Well, it depends on what dose that they're on.
Mhm.
But it also means, is there a time to take a diet break? And maybe, hey, let's incorporate some more foods that you've been craving that you like, but do it in a controlled manner. That's what I would recommend. Like there's certainly ways to pepper that in like during the week, or maybe we just take like 2 to 3 weeks of just, hey, let's just work on maintenance and let's
Mhm.
enjoy some of the foods that you really like, but we'll do it in a smart way so that we're not gaining.
Right. I think that would be the question. They're like, "Well, how can I do that and not gain weight?" Well, what is the smart way of doing that? Someone asked you that.
Um, I think it's setting a relative calorie range, making sure that you're getting in enough protein, and then just freestyle it from there.
Hmm.
Honestly,
Hmm. That also helps our mental state, really.
yeah,
Even though we think it's gonna like freak us out, but
diet fatigue,
hmm.
man, it kills you. You
Hmm.
know, everyone experiences it to some degree.
Yeah, absolutely. Thank you guys for hanging out. I don't know how much longer you have, Booty. We got 150 people in here, which is great.
Oof,
Um,
I should probably go here
yeah.
here soon.
So, last minute questions, guys, please. How often do you drink the whey collagen supplement? Christine is asking.
I mean, you could drink a whey protein shake every day. You can drink, that. So the one protein thing drink that I do every day is my protein coffee, and that's in the morning. I do a horchata protein powder, and I love how it mixes with coffee. So that's kind of my thing in the
Oof,
morning.
love it.
But I have other protein powders that I'll use to like help with like mixing in desserts, like with Greek yogurt or fruit as well.
Yeah. So, horchata, where do you get this? What's it called?
The company I buy it from is called Primeval Labs. They have a storefront on TikTok. That's how I get it. Yeah, horchata. It's like Mexican cinnamon creamy kind of drink. It's very tasty.
So good. So, Y and J is asking about calories. How do I know how many calories to get for my weight?
Mm. So you want to use a calculator, and I know AJ over there has got one in her profile that you can
Mhm.
check out. So go check out AJ's profile so
Yep,
you could figure out what your calorie intake should be.
absolutely. Suggested protein powder, Char is asking. Is there anyone that you wouldn't suggest, I guess?
Um, I guess I would say I am not a big fan of only utilizing collagen protein powder. Um, just because if you're going to do a protein powder, I'd rather it be complete. And if you do a complete protein powder, because collagen you can't use for everything,
Right.
then at least if you do a complete protein powder, it can be used for everything. But if you like a collagen protein powder in addition to what you're doing, it's fine. But I wouldn't necessarily say there's one you would avoid, other than the one that was a scam out of California, where this couple that were selling like bags of sugar and calling it protein powder. So
God.
it tasted really good,
Oh my God.
and it was a total scam.
Shut
Like,
up. I didn't know about this.
don't buy that one.
That is hysterical. I mean, not
Yeah.
really, but holy moly.
Yeah.
You're
Yeah. If you
welcome,
look,
Christine. Yeah. Oh my
mhm.
God. So, one last question, maybe. So, people here, how much protein should I have per meal? Is that a real thing? Do I absorb it all if I have more than 30 grams? Like, what is your thoughts on that? Deb Kepi's asking.
I don't really worry about the amount of protein per meal. I worry about protein during the day. I think the protein per meal is more for people who are like athletes and are like doing like weight class activities where they have to be very careful about
Mhm.
how much they lose, but they're already really lean as it is. Um, but I think other than that, I just don't think that it's necessary to make sure you're getting it in all during the day. But it's perfectly fine to do that, because for some people, when they get in an adequate amount of protein in each meal, it just keeps them from being too hungry, and that alone is a big issue.
Yeah, absolutely. Lori, I've lost almost 200 pounds total, 86 around 86 in the last couple of years with tirzepatide. So, guys, thank you so much for the questions. Thank you so much for hanging out. Thank you, Matt, for spending a little bit of time with me this morning. It's always so awesome to have
Sure.
you.
Yeah.
But
Oh,
Zach,
Emma had a question about what if dairy is a problem, and Anne Marie asked the right question.
yeah,
I'll just say that if you have an issue with lactose intolerance, there are three different types of whey protein powders. There's whey concentrate, and that has some sugar, so it's going to have some of the lactose in it. Lactose is the sugar that's in milk. Whey protein isolate is going to have less of that, and hydrolyzed whey protein is going to have basically none. And so even people who have lactose intolerance could do hydrolyzed whey protein without any problem because it's the protein, it's not the dairy sugar.
mm-hmm. Yeah. Hey, Tristan, nice to see you. Well, thank you guys. Make sure you follow me if you haven't clicked the follow button. Make sure you follow Matt. Click his name a couple of times to follow him. He goes live 6 p.m. Central Standard. And yeah, thank you for coming up. I appreciate it.
Hey,
Always
thank
great.
you, AJ. Always great to talk with you. This is
Yeah,
always fun.
always fun. I'm going to let you down in the chat. Okay.
Sounds good.
Okay. Bye.
Ah.